Welcome back, and thank you so much for staying with us. If you're joining us right now, we're speaking about misconceptions and myths around plastic surgery. And we had a question of the day for you. We asked you earlier, which age group do you think undergoes the most plastic surgery procedures, and why do you think that is? And we have a couple of your responses on Facebook, which are quite interesting. And Ledama Baronke Ole says 40 onwards. Reason is that old age got them off guard. Okay. Govan Onyango says youth at their prime caused by body shame, pressure from the society. And VW Victor says 30 to 45. You know, older women because wakona pesa na wanataka kuvutia vijana. Brani Vanessa Swift says not Gen Z. Karinga Supermarket says 35 to 60, and Ken Kalala says some socialites age mates. Yeah, anyway, so let's take a look at the dynamic of the costing here, right? Like I was mentioning to you right before the break, if you look at different articles, different stories being done, this particular procedures were basically done by those who were affluent. These days, anyone in society who may be able to save or get that money will get these particular procedures done, whether in Kenya or out of the country, right? So for you, have you seen that to be true?
Yeah, like you say, initially, you know, it's always thought of something that's, you know, for the affluent, but, you know, things have changed quite a lot these days. And we have scenarios in which a lot of the middle class, upper middle class and the upper class are coming in for these kind of procedures. And again, also depends on the environment. There are countries where it's very easy to get credit. So you'd have a lot of people doing these procedures, you know, purely on credit. The cost of the procedures, honestly, really just, it varies. It varies based on where you're getting it done. You know, different institutions have different pricings and all that kind of thing. The equipment or the technology that's being used to get it done, and also the amount of work that you have done, that you want done. Because if you're just coming in for a liposuction, it's very different from if you're coming in for liposuction plus BBL plus breast lift and all these other things.
Yeah, that's a lot.
So all that affects affects the costing. Yeah, so, you know, that's pretty much where. Is it
even healthy for all that to be done at once? When it comes to healing?
I would answer yes and no. It depends on where you are and what it is that you're doing. It's a decision that's usually made based on the patient that is in front of you. It's not something that you can generalize. For example, the age of the patient depends. The size of the patient depends. How many hours you're going to spend during the surgery also is a factor. So it's something that you tailor for the particular individual. In majority of patients, they will say, okay, no, listen, if you want, you know, we can't do 3, 4, 5 procedures on you done at the same time. Let's break them down. Okay, let's start with which one is the most pressing concern for you. Let's start there. All right, let's do this one. Let's give it a year, and then, you know, we see where we are, and let's, you know, come up with a treatment plan, you know, that may be 4, 5, 6 years long, depending on the patients.
That's
again, the key thing and the priority here is the safety of the patient. Okay. Yeah.
I see. And what are some of the challenges that this field has? Because, like I said, as much as it may be popular now we're looking at it as a whole, right? We're looking at it as the reconstructive bit, and now the aesthetic bit. You know, let's put all that in there and look at yourselves. You're not quite many, and the demand is high. Meaning, if there are quirks, of course there are, quirks out there will also benefit. You know, for people who may not have meet the threshold, especially when it comes to the financial perspective, they may go to someone who's substandard and the like, right? So what are some of the biggest challenges in your field?
So the challenges that we are experiencing here in Kenya are challenges that have been there internationally. You know, the US went through these problems, the UK had these problems, where, you know, like you said, the very well-trained professionals are few, but the demand is high. And that creates a scenario in the market where you have mushrooming of different clinics that don't necessarily have the credentials to perform some of these procedures, but are able to convince patients that they can do them. A lot of the red flags that sometimes you see, and that you kind of need to watch out for these kind of centers, is you'll find they give you deals that are too good to be true. Okay. Right. If somebody is telling you that they can give you a Brazilian butt lift for 50,000 shillings, you really need to question what's happening there. Anything, like they say, if it's too good to be true, it probably is. So those are some of the kind of things that we need to look out for. Again, there's a lot of false advertising out there as well. I normally have some patients who reach out to me, for example, on social media, and they'll send me DMs asking me what I think about particular procedures. And even right now we were discussing about procedures where they put something on your skin and it sucks.
Yeah, the vacuums.
It vacuums your butt, and this is supposed to magically make it bigger. The body doesn't work like that, and it's not logical. And if you're sitting down with this person and they're not able to explain to you how this thing actually works and break it down to you in a way that's digestible and that makes sense to you, then again, you probably need to seek a second opinion. So there's a lot of that in the media, and they lure patients in by selling them things that are not achievable, or that are very cheap, or that literally sometimes also just don't make sense. And they make a lot of money out of doing that.
Okay. Yeah. Now let's take a look at this other angle, whereby some people have a lot of surgeries, just not per se cosmetic or even reconstructive. Just have other unfortunate issues in your body, and you've just gotten a whole lot of surgery, and you want something now done that is cosmetic, and your body may not be able to even handle that, and you are not satisfied with exercise and this normal day-to-day routines that should make you feel or look better. How would you advise such such patients?
Okay, again, so this is where the consultation comes.
Back to the consultation.
Back to the consultation. Everything begins and ends at the consultation.
All right. Okay, that is fair.
And I always encourage patients, come in for consultation. Okay, let's not engage on social media. Come in for consultation so that they can answer these questions holistically and come up with a treatment plan. And the barrier for entry for the consultation is not usually very high. It's not very expensive to just sit down with me for 1 hour so that I can explain to you these things. Because we need to look at what surgeries did you have done, and how does that then affect what outcome it is that you desire. All right, and if we feel that the surgeries that you've done make the procedure that you want impossible, then what other options are there that exist that we can give you that maybe can be less invasive, or just require you to make a change in your lifestyle? If you honestly sit down with a board certified surgeon or plastic surgeon, or somebody who is well trained, their first reaction is not to try and get you into surgery so that they can make more money. It is to be able to give you your desired result in the safest way possible, because you also have to remember that this person's reputation is at stake. So they will not go out of their way to recommend something to you that is unsafe or impractical if you sit down with a very good professional. If you're not sitting down with a professional, they do not have anything at stake. They do not have their reputation at stake. They do not have their board registration at stake. So it's likely that they can pretty much sell to you anything that they want. Right. So for those, to answer that question, I have to take it on an individual basis to figure out particularly what this patient wants and what has been done before, and advise. And these are things we do on a day-to-day basis with the patients who trust us enough and come in and actually sit down for the consultation. And they'll tell you there's a big difference when you see a proper surgeon as opposed to other places where they've gone before and haven't had the same kind of level of consultation or conversation with their surgeon.
You know, one of the other biggest issues is the advertisement of this, whether, you know, on social media and on different platforms. So going back to the issue of, you know, quirks, and also looking at people maintaining results. Like you said, there's some procedures which you cannot even say that this will last long. That does not mean the body can work like that at all. Now, we've come to a place where this person is having an invasive surgery, but they cannot seem to maintain the results afterwards. And it's quite sad, because again, it's quite expensive. But the aftercare, you know, everything you've been able to do in a few months or years goes down the drain. What happens that someone or individuals may reach a particular point?
So a lot of the time when the patients come in for the consultation and they want a particular procedure, your plastic surgeon will talk to you about the procedure and also give you a horizon in terms of how long these results will last and how you can maintain those results for the long term. It's not realistic for you to have, for example, a tummy tuck done when you're 40, right, and have a fantastic result and expect to look the same when you're 80, right? Because the body ages, okay? Your body is going to respond to the things that come with age and life and all these kind of things. So for example, if you get the tummy tuck done, but you're still not maintaining a healthy lifestyle, you're not eating well, you're not exercising, then it's likely you're going to get a deterioration in your results. And when you sit down with your plastic surgeon, they will tell you as much. And we always tell our patients, look, the patients who have the best long-term results are those who are committed to a healthy lifestyle, diet and exercise and all these kind of things. And we see them and they get fantastic results and they end up being very, very happy with them. And again, the beauty about sitting down with a professional is the honesty that does come with it. We're not going to sell you things that are not safe and again, that are not true, for example. So if a patient is coming in for Botox, I'll tell you, look, your Botox is going to last you 4 months. Okay, I won't tell you, let me give you the Botox and, you know, we'll fix your face completely and you're going to be like that for the next 1 year, because you're not. The truth is it's going to wear out after 4 months and you need to come back for a top-up session. Yeah, so it also, there's an integrity that comes with the profession that mandates us, you know, to be able to be honest with the patient. And again, it's why it's super important to just sit down with
biggest issue here is and consultation.
Yes, and consultation.
All right.
Yes.
There's been, I believe, almost a very critical conversation about now the reconstructive bit. You know, like you said, about burn patients, cancer patients and the like. If you read some reviews, some men or women will say, this doctor botched my look. You know, yes, I was unwell, but couldn't they have made me at least, you know, have a semblance of, you know, the way I looked before, and just put me together in a way that is respectable. You know, I'm sure you've had those conversations. It's in your field. And they're quite disappointed because they don't feel as human or as confident as they used to, because again, what put them there in the first place was this particular condition.
So I'll push back on you a little bit, because I don't like the term botched.
Because you don't say botched.
Well, we don't say botched because you see, botched implies that, you know, the person almost went in with an intention for you not to look good. Okay, like I said, every surgery does carry complications and potential risks. So, you know, I prefer kind of using that terminology. Now, if we're talking about reconstructive surgery or any surgery for that matter, it's important to remember that plastic surgeons and surgeons, we are not godlike beings, okay? We cannot completely restore you from what you were before, you know, how you were born. That is something that only a higher being can do.
But do you usually find that that is expectation, that you should be able to?
Yes. And again, that's why the consultation is important, because we're able to manage those expectations and tell you, like, look, this is what we can realistically achieve. So we can get you from here to here, but we cannot necessarily get you back, you know, to where you used to be. And, you know, setting that kind of expectation for a patient is you're setting yourself up for failure or for problems, or the patient coming back to saying that, you know, you botched my procedure. Okay. And again, when we're just talking about reconstructive surgery alone, the main thing you're trying to achieve with reconstructive surgery is restoration of function and form. The aesthetics and the cosmetics come a bit behind those two things when we're talking about reconstructive surgery per se. So, for example, if you have no flesh on your face, one half of your face, we need to put the flesh back, okay? And that's the primary goal, okay? There's the aesthetics about it and how that flesh looks. But remember, it's not going to look the same like before your accident, or you know, you're not going to look 100% like that. We will try our level best to get you there, but it's setting unrealistic expectation by telling you that, no, I'm going to have you looking perfect, okay? We very rarely or ever use that term in plastic surgery, okay? Because it's not about perfection, it's about getting you as close to it as possible. Yeah. So
do you think now the term comes in from the kind of exposure that, like we mentioned earlier, people have gotten from different, you know, that is why there's almost a demand, like why can't this particular doctor get me to look a particular way? Yeah. You know, so what about the cases of, you know, professionals certified, but they're careless, you know, in this particular ends? Again, your industry has been rocked with a lot of issues here and there when it comes to you know, funding, when it comes to different, you know, ways. So some motivation is not quite there, right? If you watch the news, it's you know, a strife with those particular aspects. So again, you spoke about integrity as being quite an important you know, thing in all this. So when you have a patient coming to talk to you and to see you, despite all of this happening, this is now a personal motivation, if we can say, or initiative. Can we say that? Yeah. At the end of the day, like now, Dr. Gallo, I'm coming in for a consultation. Yeah. It will be now your personal initiative motivation, right? Yeah, it would be. I mean, if you're talking about there being honesty during the consultation, and being able to tell your patient, like, look, this can potentially happen, or, I mean, even the topic that you brought up. The issues surrounding the industry. Yeah, the issues surrounding the industry. We address all those things during the consultation. But you also have to remember... that may directly affect maybe the work? The work? That may affectly direct maybe the services, for example. Like if there's a slow go, you know, it may affect maybe a particular service for that matter. Is that what you mean? Yeah, no, I'm saying, you see, the industry, it's like plastic surgery doesn't happen in like isolation. Right. So everything else that's happening in the industry does have an effect on, you know, how we practice. Yeah. Okay. Anyway, I understand that. I mean, it's a very interesting topic for this part of the country, or this side of the Sahara, if we may call it that, because it's popular, like I mentioned earlier on when we began the conversation, but at the same time, it is something that is taken as, we cannot speak about that because, again, African culture. Yeah. You know, we are exposed, but at the same time, it is something that people may wonder, why are you touching your body? Like, why are you, well, how dare you augment what God has, you know, done? But at the same time, some people will tell you of the benefits and how healthy it is to have things done by proper people who are certified. And I'm happy that you mentioned, again, continuously, that it has to be a board certified, you know, surgeon for this matter. So let's take a look also now at the successes of, you know, this procedure, and the people who've been able to benefit from. How does this now look like on the other side? Because we've spoken a lot about the challenges, misconceptions, you know, myths around it, how realistic a procedure can stay, how long it cannot stay. Yeah. You know, if whatever is happening in the industry faces this or that, you know. But how does the success bit of this look like? So I'm glad you bring that up, because the success stories are way more than the ones that go wrong. I can assure you, every single day
plastic surgeons in this country, my colleagues, you know, and myself are doing procedures, plastic surgery procedures, and you know, the good majority of them end up with very good outcomes and very well satisfied patients. What does this look like to the patients themselves? If the expectation was one that was reasonable, and you know, the patient completely understood what they wanted to get out of it, and you know, the doctor was able to deliver on the brief, so to speak, then it can be life-changing, because sometimes it can get lost in a lot of the way we are socialized around plastic surgery. But at the end of the day, there are actual people behind some of these procedures. There are actual people who have struggled maybe to adjust in social settings. There are people who have struggled to date. There are people who, when they wake up every single morning, they do not like how they look in the mirror. That affects their confidence. That affects how they do their job. That affects how they relate with their partners. That affects how they experience the world. Now, if I told you that, you know, for the rest of your life from now, you would experience life in that manner, not liking yourself, not liking your job, not liking how you relate with your partner, and it's because of just one aspect of your body that you don't necessarily like, and I told you that, look, we can fix that safely and with a good outcome, and that actually happened, you start a new, completely different life. Now, one that has you with a better outlook. You're more confident. You're now able to relate with your partner better. You're now able to date. You're now able to enjoy the things that people who may not necessarily understand or experience what you experienced actually do on a day-to-day basis. There are a lot of things that we take for granted on a day-to-day basis, and those patients usually tend to be very, 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 very grateful for, you know, what they were able to get. It's not often that you'll find a patient who has regretted the surgery that they did, the plastic surgery that they did. And unfortunately, these are not the stories that, you know, would end up in, you know, in the media, but you know, there are many of them.
Okay.
Yeah.
So it's quite life-changing. I think again, the assumption of not considering the emotional bit. Even when we discuss the emotional angle of things, it's always, again, you know, on the negative. You know, in our society, when we're debunking things, we debunk the negative first. And I don't think we put in the psychological perspective that someone may not like. We are evolved, but to an extent, there's still the judgment on why would you, you know, like that's why I keep repeating to you, like someone would ask, why would this person consider altering anything? Aren't you, you know, happy with how you know, you came out? So I think if you could just make it clear, especially the psychological bit of how someone feels after, like the way you said, they can be able to do normal things, because the assumption is, why you not, like, why do you need to alter something to do normal things, you know? But you practically have seen, you know, you've seen the difference that it can make. So I think that is the angle that mostly, you know, you find people having a fight with, either privately or outwardly.
In my experience, and like I mentioned to you, a lot of the patients who come in are women, and women tend to be very headstrong once they know it's something that, you know, they want and achieve. And a lot of the women, for example, that I've come in contact with, are convinced that this is what they want, and this is
what can change for them.
Yes, and what can change for them, and they don't get swayed too much by the external noise. People are always going to debate every single aspect about you, the good, the bad. They will always try and you know talk and try and legislate what you can and what you cannot do with your body based on their own personal experiences, their own personal biases, their culture, their religion, and all these kind of things. But at the end of the day, the decision comes from the person themselves, because for them it is a lived experience. They're the ones who have to walk out every single day with themselves and with that body and, you know, go out there. So, you know, my encouragement to anybody who is considered it or feels like, you know, there's something at the back of their mind that's really nagging them about, you know, their body, but they're conflicted by everything that they see, especially on social media. I would just, you know, encourage them to, you know, kind of just listen to your own voice. And, you know, at the very least, just have a consultation with your plastic surgeon. Just sit down, have that conversation. It doesn't hurt, it doesn't cost a lot of money to just have the conversation. Once you come in for a consultation, it's not a must that you have the surgery done. Just come, sit down, get all the facts, get the right information, and make an informed decision. All
right. Dr. Gallo, thank you so much. Thank you for having this simple but complicated conversation. We appreciate it. There's so many, you know, angles to it, but you've done the best to, of course, give us the perspective on the myths, misconceptions, and the success bit also. So thank you for our audience also for tuning in today and for your feedback. Today in studio we've had Dr. J.P. Ogallo. He's a board-certified plastic reconstructive and aesthetic surgeon. All right, thank you so much for watching. We appreciate you tuning in today. Remmy Majala, we'll see you again tomorrow.